First of all, I want to thank you for taking the time and coming over, Ms. Sylvia Lemus from Sonoma County. And so, one of the issues, besides the negative numbers that we have, 128 people who have passed away, we know the second wave of COVID is coming now to Sonoma County, but we are still in the color purple here. What can you tell us about
Yes.
why is it that Sonoma County is not, the situation is not getting better? And what is the county trying to do to better the situation for everybody?
Okay. Well, first, I'll just share that based on this week's numbers, Sonoma County remains in the purple tier, which is the lowest level of tiers in California, and that's based on the California Blueprint for safer economy. So we're in the purple tier, which is the lowest. We have an adjusted daily rate case of 10.6 per 100,000 people, and this is beyond the benchmark of 7 that is required so that we can move into a less restrictive tier. We have a test positivity rate of 5%, and that 5% is well below the benchmark of 8% that's needed to transition over to the red tier. We have also moved into the red tier under the state's new equity metric. But we have to still be in both metrics, have to match for 2 weeks in order for us to fully move into the red tier. Um, so our test positivity rate for the most impacted is 7.5%, which is below the state benchmark of 8%. So we're kind of dealing with multiple metrics based on the regular metrics and the equity metrics. Um, you can also find current status and information about tiers and allowable activities at the state of California's Blueprint for Safer Economy website. So one of the things that you had asked is about why is it that we're here, and I know that there's still a lot of work to do, but I know that the county is also working on a plan, the health department with the county, together we'll be working on a plan, and we have different efforts with the Latinx Health Task Force and different efforts that we have. So we hope to come up with more work up ahead that will improve the situation. And I know many in the community are frustrated by the many challenges that are facing our efforts to open schools and the economy safely. But the primary drivers are socioeconomic disparities that are pressuring essential workers and those living on limited incomes to go to work despite the safety concerns. Without sick leave or job security, these workers simply can't afford to miss a shift. In addition, leaner incomes compel the sharing of shared transportation, shared housing, more people in less space, fewer childcare options, and there's also caution about accessing government services for available resources such as like alternative care sites, where people can isolate and not infect others. But sometimes there's some kind of caution or people are unsure about accessing some of those sites.
Definitely. And then moving towards upcoming holidays, we have
Mhm.
Halloween for most of the people in the United States, and then we have Dia de los Muertos, Day of the Dead for our Latinx community members. What are
Yes.
the regulations in regards to that? Obviously, it sounds like everybody's encouraged to not go door to door to
Mhm.
get candy, all of the stuff. What is the county saying here?
Yeah, so we just issued a press release on both Halloween and Dia de los Muertos, and the state also issued guidelines, and so we issued ours based on the state guidelines. So we are reminding residents to please plan ahead to celebrate safely this year and avoid gatherings. Many traditional holiday activities promote gatherings and the mixing of households, but this year it increases the risk of COVID-19 transmission. So consistent with the CDC and the state guidelines, the health department for the county has issued guidance to help us celebrate. Given the risk of transmission, for example, Dia de los Muertos, indoor gatherings and events or parties with non-household members are not permitted. Outdoor gatherings are permitted as long as there are 12 or fewer people from no more than 3 households. And as long as they are still using their COVID protocols, such as wearing their face coverings, social distancing from other people that are not part of the household, and that the regular hygiene standards are being kept. Carnivals, festivals, live audience entertainment are not allowed this year. Um, Again, and many Dia de los Muertos activities are permitted, encouraged. So we ask people to be creative in their celebration. Some of these include visiting and decorating the graves of our deceased loved ones while maintaining social distancing, wearing face coverings, washing your hands frequently, preparing food or playing music enjoyed by loved ones, decorating images and objects in your home. So there's some of the recommendations, and there's more, in our press release. We can kind of, we are working with some nonprofit organizations, and we'll be disseminating more information about suggestions of things that we can do, what's not permitted, and what suggestions of things that people can do. Some Halloween activities, for Halloween, traditional activities like door-to-door trick-or-treating, business-to-business, or trunk-or-treating, those type of things are discouraged this year because, again, the difficulty of maintaining the proper social distancing and the risks associated with touching the high-contact surfaces like doorbells and candy bowls, the same hands and different hands kind of
Hmm.
in there. So higher risk activities for Halloween that are not permitted include carnivals, festivals, live audience entertainment, indoor haunted houses, indoor gatherings, events, or parties with non-household members. And then following recent state guidance with private gatherings, again, only outdoor gatherings of 12 or fewer people with no more than 3 separate households are allowed. And just maintaining all the same, 6-foot distance, facial coverings, and all the different protocols. So some alternative things that people are encouraged to do is maybe online parties, online like dress up parties, car parades, drive-in movie nights, Halloween themed meals at outdoor restaurants, outdoor drive-through haunted houses, and if safety protocol can be maintained, maybe visiting pumpkin patches or other seasonal venues. So those are just some of the things, but we just ask people to be creative and be safe this year.
Definitely. And then moving forward, what can you tell us about the flu shots? Again, we don't want to fill all the emergency rooms with people who may think they have COVID when in
Mhm.
fact they may just have the flu.
Yeah.
Should everybody get the flu shot this year?
And we are recommending the flu shot to everybody, especially for people in the health care area. But we recommend it because, like you said, they're similar. Some of the symptoms are similar, and we want to reduce the chances of people with flu going to the hospital and it's not COVID, and vice versa. It's too much complication,
Hmm.
and it's a burden on our hospital services and our healthcare providers. To have both of these illnesses that they have to deal with. So, because the COVID-19 vaccine is not expected until at least early next year, and we're concerned, like I said, about the twin demic, the two things going on at the
Hmm.
same time. We encourage flu shots for everybody. And there's also an expansion for healthcare workers, with few exceptions, must receive flu shots. The expansion will include emergency medical services personnel, healthcare staff in hospitals, skilled nursing, other long-term care facilities, outpatient medical clinics, hospice, and home agencies. Since the elderly remain mostly at risk for serious health outcomes for both diseases, we recommend that all congregate care facilities also participate. So we're strongly recommending kind of far-reaching flu shots for everybody. Influenza vaccines have long been accepted as pretty safe and effective, a way to prevent millions of illnesses and thousands of doctor and hospital visits each year. Um, so we do recognize it, and we do ask that people get vaccinated. The expansion of this order does apply to all persons, paid or unpaid, who work in healthcare facilities. Even though some people may not be able to because of medical disability or religious exemptions, we do require them to wear face masks. And additionally, facilities allowing exemptions have to inform the county of how many accommodations they've granted.
Good.
So,
And the last thing, partially because of time
mhm,
and because it's important, the Supreme Court of the United States, people have the right to their opinion, but the
mhm,
Supreme Court has determined that the census can end today
mhm,
at midnight. If you could
yes,
give us maybe a
mhm,
website where people could go to for
mhm,
that, or a phone number so that people can finish up their census form today,
mhm,
and that
yes.
way, again, be counted, because that
Mhm.
means millions and billions of dollars in education services, roads, and many other things.
Yes, that's so true. Originally, we had until October 31st, and then all of a sudden last week, it went to the Supreme Court. Like you said, they changed it till today. So today is the final deadline at midnight. So
Hmm.
there is information here. So if you haven't filled it out, there's still time to do it by midnight, excuse me. So if you go to my2020census.gov, my2020census.gov, it only takes like 15 minutes to complete it. Then you can complete the census online. You can also call a phone number and they will help people in Spanish. The number is 844-330-2020. That's the phone number to call. And we really encourage everyone, like you said, to complete the census. It's so important that everyone is counted, and it doesn't matter, if you're a citizen or not a citizen. Everyone should be counted. So we want to make sure that people are counted with the census tonight.
Definitely. And I want to
Mhm.
thank you again for taking the time today.
Mhm.
Once again, Sylvia Lemus, for taking the time and being with us here on KBBF in the
Thank you.
show Líderes del Futuro. Look forward to our conversation next week when I also
Yes.
want to take a little bit more time and cover the elections and voting specifically.
Yes.
Where can people vote? I don't know if you
Mhm.
will might be able to actually bring some of the locations for next conversation. I
Sure, I
know
can
that
bring
I
it.
didn't ask
Mhm.
last week, but if we could do that for next
I
week, I
will
would
do that.
appreciate it.
Sure. Okay. All
Thank
right. Thank
you.
you, Rafael. Have a good night.
All right, you
Bye-bye.
too. Take care.